probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information, and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, everyone, and welcome to another episode of You and Your Doctor, sponsored by All County Healthcare. You're able to listen to us on 96.9 and 95.3 and watch us on amp2.tv. I am your host, Rayma Phillips, and today we have a very special doctor with us today, Dr. Mohsen. How are you doing today?
Thank you, Rayma.
It is a pleasure for us to have you today. Dr. Mohsen is the owner of Wellness Neurology of South Florida, and they are located in Miami-Dade County.
Yes.
And we're just so excited to have you on the show here today. So how are you feeling today?
I'm doing great.
You're feeling
Thank you for having
good?
me. Yeah, sure.
Amazing, amazing. So why don't you go about and tell our listeners and viewers today a little bit about your medical experience and background previous to being here on the show today?
Sure. I did my residency in Temple University in neurology. The year before, I did 1 year of internal medicine in New York Hospital.
Oh, wow.
After the residency, I moved to St. Louis. I did my fellowship. Then I started practice. I worked in different states. I worked initially in Missouri, then I moved to Tennessee, then I worked in Pennsylvania, then I moved to Florida.
Wow, so you've been all over the country, I should say.
Met different community and wonderful people in each state.
That's amazing. You really do. You're able to find a sense of community, especially with the specialty that you're in. Speaking of specialty, so Dr. Mohsen is a neurologist. So can you tell our listeners and viewers a little bit about what kind of brought you into the field of neurology?
Sure. When I started medical school, I was thinking more about going to medicine or surgery. Then during residency, neurology was transforming from passive medicine to active medicine. So instead of just diagnosis, then you have opportunity to do something active to your patient. And neurology cases, usually if you treat them, they can lead to long-term disability, which affect the patient and the family and could be very demanding.
Absolutely. So was it a sense of being able to help more people in this area, especially since, you know, as a country we need doctors, especially specialists. So would you say that was another contributor as well?
Of course, yes. Helping people is a great thing. And matter of fact, my wife have a medical condition, so chronic condition, so I know what family feel. I see it from doctor and a patient perspective, so helping community is a great feeling, it's very powerful feeling. It's very rewarding.
No, absolutely. Working as a personal trainer myself, I know what it's like being able to truly help people and change people's lives. So I'm very happy that you're able to find a field where you're able to do that and help your wife in the process. So getting into our interview now, neurology is a very broad topic, and it's also a topic that many people don't really know about. When a lot of people think of neurology, they think of like brain surgeries and things like that. So can you tell us a little bit about what you see and what you deal with on a day-to-day basis in your office?
As you said, neurology is very wide spectrum because you have the acute phase of neurology, which people have acute conditions, which you see in the hospital, and you have the chronic condition, which you see in the office. I agree with you, neurology is different from other fields of medicine because you have multiple organs. The cardiologist handle the heart, the pulmonary, the lung, but we have the nerve, the brain. Also, we deal with this, the emotion part of it because all are connected.
That's very interesting for sure. When you say it's all connected, what are some common things that you see in your office that a lot of people may not know to go see a neurologist for in particular?
There is a lot of underdiagnosed depression and anxiety, a lot. Sometimes people ignore stroke signs, which is very important. That's the majority of cases there.
So I know you just mentioned a little bit about strokes and coming from someone who's experienced something like that before. Do you mind telling some of our listeners or viewers about some of the symptoms that, or just kind of the background about what a stroke really is and some of the symptoms that people may experience?
I like to talk about stroke because it's very common. Each year there's 800,000 new cases.
Wow.
In 2017, as example, the cost of a stroke and treatment and time off, approximately 55 billion in the economy. As I told you, a lot of time people ignore the symptoms. So we're going to talk, if you don't mind, about stroke in general. What is stroke? A stroke is a medical emergency. When the blood flow stops, go to the arteries, like a heart attack. When the blood stops, the brain suffers. I can say some type of a stroke generally so people have some idea. The stroke, the most common is that when a clot or a blood flow stops, it's 85%, and stroke could be opposite when the blood go outside or a bleeding stroke, which is 15%. So the artery work like a pipe, right? So sometime when there is risk factor, this pipe closes and the blood stops, so people develop stroke symptoms. It depends which area in the brain that's affected, you get the symptoms. So it could be wide symptoms. A lot of time people can ignore the subtle symptoms. So the risk factor, the most common risk factor, 1 of 3 people in the United States have these risk factors. Number 1, high blood pressure. And it's very important, high blood pressure, because people ignoring it. And it can lead to both blood flow problem and can lead, it also cause bleeding stroke, so can cause both types of stroke. Diabetes, obesity, high cholesterol, smoking, and some heart condition. This is the most common things to cause stroke. I think you asked me about the symptoms.
Yes, I did.
So the way to help general population to handle stroke in general situation, the word fast. Fast, F standing for face. When we notice sudden change in the face, numbness or weakness, you can ask the person if not sure to smile, then you can appreciate. Fast. Then second letter is A, the arms. If the arm become weak, or the leg too, but A stands for arm. You ask him to move the arm if one arm is weak. And from the S from speech, if you notice any speech problem. The T for time. So if you see any of these, you need to call 911.
What did the T stand
T
for?
for time, the time sensitive.
Time.
If you see one of the F fast, you're going to call 911.
So
Also, sorry to interrupt.
no, it's okay.
A lot of symptoms, sudden headaches, confusion. Sometimes people miss confusion because confusion could be sign of a language problem. Dizziness, vision changes. Again, each area brain affected can lead to the stroke.
Do the symptoms vary versus men and women?
Not really.
No.
It depends which area is affected in the brain, what you get the symptoms.
So again, for our viewers listening, this is extremely important information. You have face, or what was the?
Fast.
Fast, I'm so sorry. Face, arms, speech, and then time sensitive. So those are the 4 things, the 4 indicators to see whether people are occurring or having a stroke during that time. So can you, I know that you have your notes with you today too, can you tell us a little bit about more of I guess, why we're starting to see so many more strokes within our community nowadays?
Because of these common risk factors, the people ignore follow up with the primary. They ignore sometimes to check their blood pressure. Again, there's a common risk. The diet. People need more healthy lifestyle. Actually, it's easy, very easy to prevent a stroke. You need a healthy lifestyle, which is mean exercising, and I think you are expert.
Yes.
You need 2.5 hours for adult per week, right? Medium intensity exercise, and for younger, 1 hour per week. I don't think we are very active. The diet, because if you don't eat healthy diet, you have trans fat, you have cholesterol, you have high sodium. All this lead to high blood pressure and diabetes and put you in risk of having a stroke.
Especially since now so many people are working from home, you're starting to see so many more people. I can't tell you, I have clients that come in and this is like the first time they're getting their workout in all week, and I might see them once a week on a Friday because they're stuck at home at the computer all day and they're not able to exercise and take care of their bodies the way that they need to. So being able to live the healthier lifestyle, would you say that's probably the biggest thing that you can do to prevent strokes from occurring?
Healthy lifestyle, follow up with your primary doctor, make sure if you have one of these risk factors, check them regularly. Of course, no smoking.
Of course. So again, make sure you follow those tips. If you know anyone or if you're experiencing these symptoms yourself, make sure that you take yourself to the ER and also just take care of your health so we can prevent a lot of these issues from occurring. So changing directions a little bit. I know I was reading through your website a bit and I saw that you
Can
also...
I mention one more thing about stroke?
Yes, of course.
Because this is very important. I always like to say it. Each minute equals 2 million neurons. So if when you delay, each minute you're losing 2 million neurons. Sometimes 30 minutes or 1 hour delay, the outcome from going home with minimal disability to end the nursing home. So people need to recognize the importance of time.
What would you say is the age range that is the most at risk for receiving strokes?
Stroke happen any ages. One other thing is important. Sometimes people think young people do not have having stroke. Can happen any age, but 60% of a stroke above 65.
Above 65?
Yes, this is more common with age, but can happen any age for sure.
But it's more common when you're older, but it's possible no matter how old you are.
Correct.
So again, it's even more important to be aware of those symptoms. And again, we're going to say it again. Acronym was FAST, face, arm, speech, and time sensitive, making sure that you get yourself the help that you need before anything, I guess, severe happens to you. Because
there's things can be done in the first 3 hours. So when you have a stroke, you have two way of treatment. One, with the acute phase, there's a lot of option. You can give your patient the first 4.5 hours. So if you lose this window, your option change from active treatment to try to reverse the clot and remove it to passive treatment. So this 3 and 4.5 hours is very important.
So what are the most, I guess, regular ways that doctors will go about removing some of those clots for their patients?
That's what I do with my partner. So first of all, the patient need to come in time. So it's a standard procedure. We do CAT scan to make sure there's no bleed. Remember, there's 2 types of stroke, and they treat it differently. Then if there's we do a checklist, detailed checklist to see if there's a patient candidate for very strong blood thinners called TPA, which is you give over 1 hour through the veins, and this is medication usually remove the clot. But sometimes the clot could be big and large, the medication not be able, then we send them to special testing, look to the artery, and they have new devices now to remove the clot mechanically.
But it's, again, it's still very time sensitive in order to get that done.
Is the most important factor.
So what happens if patients are not able to get to emergency room within that 3 to 4 hour time frame after having a stroke?
Then there is a different secondary way, like we keep the blood pressure high to keep blood flow going because we lost the opportunity to give the TPA. But the mechanical retriever or devices have window sometimes 12 hours, sometimes a little bit more.
Oh, wow.
The devices, not the medication. There's passive treatment, again, if you lost the option to do active treatment. So again, time is the most important thing.
Just to make sure, I want to make sure this information is correct too, but after you receive that brain damage from a stroke, there's no way to get any of those things back, correct?
So when a clot happens, there is an area in the brain already dead.
Okay.
And there's an area of the brain is not dead, it's in a shocking stage. This is our goal, to try to move it back to active stage. Still not dead. So you have a lost area, and you have area decided to gonna die in the future. So when the presumed blood flow to it, it survive and brain recover.
So you have to make sure, no, that makes a lot more sense. Thank you. Is there anything else that you would like to add or tell our listeners and audience about strokes?
The time.
Time.
Oh, one more thing. If you're not sure what's going on, call 911. Sometimes stroke could be misleading. Sometimes stroke affecting weird area. So call 911 if not sure what's going on.
Very interesting. And I guess that this will be a good transition to kind of switch directions of our interview. So one common thing that I know that a lot of Americans deal with on a daily basis are headaches. And I know being a neurologist, you know all the different types of headaches. So can you dive a little bit into about some of the most common types of headaches that people receive?
Right. Very common problem. So the most common type is mainly you see migraine with different type. Migraine itself is a different type. Sometimes migraine go on more detail, frequent, and sometimes people have headaches every day. Very common type also tension headaches. People have stress and need tension can become daily, which affect the quality of people's life.
Wow.
So you need to classify what type of headache is migraine, tension, cluster headaches. There's different type because each can treat it differently. You need to know the frequency, how much interfere with people's life. Sometimes people lose times of work from the headaches. Also, the experience is not fun. I know it's not, if you know somebody with migraine, the experience is horrible.
No,
and right? And there's a lot of option treatment. You know, somebody have acute headache, we give them 1 or 2 lines to let them get out of that attack. If somebody have a lot of headaches, we use different treatment to prevent the headaches, from medication by mouth to Botox to injection. There's a lot of option available. People should not suffer from a lot of headaches.
Because I know that's something that a lot of Americans deal with, are the migraine side of it, and not really knowing the best way to go about dealing with migraines. So I think this is a good opportunity. Can you tell our listeners a little bit about what a migraine really is?
Right. Well, the migraine basically is a chemical imbalance in the brain. It's a process. So if everybody have a migraine, he gonna know. Sometimes they get the warning and the auras, they get the flashes, then it evolves, they feel not good, then get intense. When the migraine peaked up, very severe pain, then you get the nausea, vomiting, then go to kind of refractory phase when they do not respond to medication. But it's an evolving process. So that's why with the right medication, you can block it and the patient recognizes the migraine. You can block it from the beginning so the patient does not go through the whole circle.
That makes a lot of sense. Thank you for that. So, again, so are there any, I guess, special or new treatments that are coming out to deal with some of the migraines that people are receiving?
There's a lot of option. I cannot mention now. There's a lot of option for, remember, the migraine is 2 treatment. For acute, when the patient experiences acute, for the secondary symptoms, because migraine have another symptom like nausea and things, that's not good feeling. And for prevention, a lot of options. It's difficult to talk about them. Plenty of options. So first of all, you need to know it's a migraine or tension headache or something else. Could be somebody developing problem in the brain. So that's why we run some tests to confirm it's a migraine.
Okay.
A lot of things can also contribute to migraine. We need to figure it out, like somebody have high blood pressure, somebody have sleep disorder. So you need to evaluate, make sure this is migraine, then see what type of migraine, how frequent.
Oh, thank you so much for sharing. So we're going to take a few minutes and go to a quick commercial break right here, and we'll be right back.
How was that?
Perfect. Yes, you're doing it.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, listeners and viewers. And again, today we are with Dr. Mohsen, who is the owner of Well Care Neurology of South Florida. And for anyone who is interested, their office is located at 14750 Northwest 77th Court, Suite 106 in Miami Lakes, Florida, 33016. And if you would like to call their office is their number is 305-698-4054. And again, we are back with Dr. Mohsen. How are you feeling after the break?
Feeling good.
Feeling good?
Yes.
Ready to get back into it?
Sure.
Amazing, amazing. So I know that in the beginning of our interview, we talked a lot about strokes. But for people like me who might not know too much about neurology and what happens up there, can you tell us a little bit about the differences between seizures and strokes?
Yes, actually they're opposite.
Really?
In the stroke, your neurons die, right? With seizure, the neuron is active. Basically, seizure, certain neuron in the brain get active, and it depends which area you get the symptoms. So if it started in particular one area, you get let's say in the vision area, you're gonna get flashes. If you get in one motor area, you get a hand shaking. If it's moving all the brains, you're gonna have generalized seizure. People shake all over it. Seizure could be primary or could be acquired. Primary, people born with seizure, like how they're born with diabetes, high blood pressure, or sometimes something happened to the brain and people develop later on seizure, like a trauma, common trauma, head traumas. After stroke, because you stroke, you lost a tissue, become a scar tissue, they may develop even seizure later on. Sometimes could be reactive. Some people who drink too much alcohol or abuse drugs, and they, when they stop drinking alcohol, their body have reactive seizure. So I think also the question on sometimes what's different with seizure and epilepsy.
Is there a difference between seizures and epilepsy?
Yes, seizure when you get the event itself, epilepsy when you have recurrent events unprovoked. So that's become epileptic patient. Seizure generally, people with seizure suffer a lot of secondary symptoms. They suffer a lot of time depression because they feel they're losing control, and some especially young people. They develop sometimes anxiety, and seizure is treatable. A majority of the cases with the right medication, with the right dose. Also the process, when the seizure patient comes, you need to run the test to make sure, as we talk, is a primary or secondary, it's something in structure abnormal in the brain. Then there's a lot of options for the patients. Each one responds to different dose, different medication. But the goal to make patients seizure free so they can drive safely, safe for them, safe for us. They need to be diagnosed and treated.
So I know you said epilepsy is when people have those recurring seizures.
Correct.
Do you deal with epilepsy patients differently than you do with people who just come in with just the seizure that one time?
That's a good question. That's a very tricky question. You know, because when you have one seizure, first of all, you need to know it's reactive or unprovoked, right?
Okay.
Because the reactive, somebody drink alcohol, stop drinking, that's reactive. You don't worry about it. But when you have your first seizure, you need extensive workup to see why the first seizure happened. And if it's testing coming normal, then we just see the patient's situation and You discuss with them. Sometimes you don't need to treat. But when you have more than seizure coming, there need to be treatment.
No, that makes sense,
Right.
especially if it's something that's recurring. But I'm very glad to hear that there's a lot of different medications out there to combat or prevent some of those seizures from
Right.
even occurring in the first
And
place.
a lot of time we try to use a medication help two things. Some of seizure medication, as example, help and anxiety. We talk about it and depression. Or mood stabilizer. So we can hit two things in one. Some seizure patients have a migraine. We use a medication help migraine and seizure at the same time to minimize how much medication they need and try to improve the quality of life.
That's definitely very beneficial to the patients as well, so you don't have to sit there and take 5 different types of medications, you know, at the start of your day. So that's
Right.
definitely very big. So I know we're starting to come to a close now. Is there anything else that you would like to tell our audience about what you do, or maybe about like a little bit of a day in the life about what you do as a neurologist?
Sure. Again, neurology is very exciting. You see different things. You have a neuropathy, you have a back problem, you have seizure, stroke, and multiple sclerosis, a lot of things we did. But again, I work in a hospital, you see different acute cases. People have a stroke, need the TP as we talk. People who had head trauma, serious problem. And the office, we see the more chronic condition. So yeah, we see a lot of cases, very wide.
Wow. Well, I hope that this interview definitely inspired people to just learn a little bit more about what neurology is and what it encompasses, definitely. And I just wanted to thank Dr. Mohsen for just coming on our show again for tonight. We are very, very thankful to have you. And I am looking forward to have everyone back for another episode of You and Your Doctor next Monday at 6:30. I hope everyone has a great evening.
One last thing. Stroke is time, each minute 2 million neurons.
You know that. Time sensitive, guys. Yes. Have a great week, everyone.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were